Welcome to Chapter 3 of the NASM Corrective Exercise Specialist series here, or for our class, it's Week 1, Chapter 3. So this is going to be our first set of technique of the 4 technique chapters that we're going to talk about. The first one here being the inhibitory techniques. So if we're going to really break it down into what it really is talking about, we're just basically talking about the aspects of self-myofascial release, all right, or myofascial, or myofascial release in general, MFR, SMR, okay, either way, it's the same. It's the first phase of our continuum, okay, as you can see here, it's the inhibit component, trying to break down adhesions and trying to allow for a little bit more lengthening to occur after, okay, so inhibit, lengthen, activate, integrate, this is going to be your inhibit component, okay, your very first phase 1, all right. So when we talk about self-myofascial release in general, what are we talking about? Like it says here, we're using it to, like it says, inhibit or modulate activity. All right, so making sure that we're taking on the pressure components, the density components, we're taking on this press and release kind of an atmosphere that we're trying to create. So when we look at myofascial rolling, it can be used in many different ways. And just to name just a solid few, but we're talking about simplistically foam rollers. This is our roller ball, so that could be any, or actually any kind of ball in general, and then any handheld devices that may work as well. And we'll get into those specifics as we get a little bit later in the chapter. All right, but we're basically using an object to be able to promote pressure to then help release the tension that has been developed and the adhesions that have built up on a specific muscle group. All right. There are obviously, so depending upon what career path you're looking to go into, what line of work you're currently in, where you might be working, there are other techniques in there, like for example, massage. All right. There are what we call IASTMs, or instrument assisted soft tissue manipulation, kind of like Graston tools that you might see out there, which are like the scraping tools. Rock tape makes I think it's called a blade, things like that. There are joint mobilization techniques that we can work with, and then obviously going back to the easier components or your self-myofascial techniques. Okay, but we're going to be working more so with, if we were to look at it, basically looking from the perspective of the career path. All right, we're going to be looking at here, and here. And then obviously this is going to be a little bit different when it comes to, what we can and cannot do. It's going to be, more job specific at that point. Okay, so we're using it. All right, we're using, these myofascial rolling techniques. Well, again, we talked about it from the last chapter, but this is phase 1, 2, 3, 4, 5, and 6 of our cumulative injury cycle. Now, if we're working with, self-myofascial rolling, this has already occurred. This has already occurred. These may have occurred. And now we're working on trying to develop something here, okay? We're really trying to get to where we can break, diminish, those effects of the, diminish the effects of our adhesions that might take place. Okay, so that's what we're kind of looking at there. So that's really one of the things that with tissue trauma, which leads to inflammation or spastic moments, and you develop these adhesions, what we're doing is we're creating dysfunctional. Eventually, at some point, we're going to be creating dysfunctional movement, and that is really where number 5 would start coming into play. Is that if adhesions are not taken care of, then this right here can get very, very scary, because once you start using muscles in the wrong way, it leads to this right here, which ultimately is going to have a drastic effect on, number 1, just a general person's movement, but also if we're working with athletes in general, that's also meaning that their athletic performance is going to go down. Okay, so we want to be paying attention a lot to that. So, if you looked previously down in the bottom here, we kind of hit on Davis's law. We're going to talk about that here in terms of the cumulative injury cycle. But if you look, you're going to see that soft tissue, so it will model along lines of stress. All right, so if there are stress patterns that are there, your soft tissue is going to adapt to those or model to those lines of stress. So if there are, if you're looking at it from the standpoint of this, just say this is the muscle fiber right here, okay, you're going to start to see these little developed adhesions that start to come off of those muscle fibers, all right, and they're going to, and they're going to raise up, and then what this is doing is it's actually taking the fiber and it's making it pull inward, okay? And pulling inward means that it's technically going to be shortened, okay? So we see that there is that, when that happens and you have this shortened muscle, then the movement starts to, that's from that stress, that muscle no longer can move the same way it can, okay? So that can be a problem. Now, if you look at it there, it remodels or rebuilds itself. If it starts to get healed, it'll then develop a collagen matrix, all right, in the right manner, and that will allow for you to be able to, basically regain muscle fiber in the way that it should be and grow back the way it is. But this here is this, if it becomes too inflamed and the additional adhesions come into play, that's when you start getting to have interesting parts that really can start to affect you greatly. All right. At that point there, what we want to look at here with Davis's law as well is what we would want to call, I think we might have hit on it a little bit last chapter, but relative flexibility, or basically finding the path of least resistance. So if you end up with imbalanced muscles, the relative flexibility you have is going to be, compensated by there's going to be compensations due to those muscle imbalances. All right, so we don't want to have this word right here that we really don't want to have happen, compensation. All right, that is what we don't want to have because this is bad. All right, and then obviously it'll lead to injuries as well. So we have to be paying attention to that. We have to be looking at that, in terms of the path of least resistance. Well, if that path is messed up, as in up here, up in this area up here, then you know that it's gonna find a different path, and that's not the correct one. All right. So, if you ever played Oregon Trail as a kid, you knew that sometimes taking the shortest route wasn't always the best route, and that could lead to, death by Oregon Trail. So just be aware. It's kind of the same principle. All right, so what we're doing here, though, is with Davis's law, and then obviously path of least resistance with soft tissue issues, we're trying to be able to roll, all right? And like it says here, we're trying to modulate the local receptor activity. There is tension via microspasms and the central nervous system activity that will develop from, these techniques to those areas that are traumatized. Now, again, we go back over to, here we're talking about tissue trauma, right, in general, all right? Tissue trauma is what is going to happen regardless, whether it be good or bad, meaning from exercise or from, bad movement patterns. But that myofascial rolling is going to help, with, basically taking and diminishing those spasms to help the nervous system work correctly, all right, to those traumatized areas so you don't develop those spasms and that tension, all right? So what we're hoping is that, with this myofascial rolling, we can break up those adhesions, or try to minimize the effect of this term right here, which would be trigger points, all right? And if you know what a trigger point is, if you were to, you feel something on, just say, your quadricep, take your thumb and run along, your the very dead center, which would be your, your the main quad of your muscle groups, right? And so with the with all four of those quads, if you take and run down the center, what we're talking about for, our for that muscle group in particular is, it's a very large muscle group. So you can take your thumb and run down the center of it, all right? So when you're running down the rectus femoris, all right, and you get to that middle point, And just say that there's a little bit of tension there and you hit it with your thumb and you get the ow kind of a feeling. That's when you know that you've hit that trigger point. And those are typically, that's the areas of adhesion. Those are the areas that you want to break up. Those are the areas that need some fine tuning. Okay, and that's what we're looking for. So rectus femoris, definitely a very powerful muscle, definitely takes a lot of abuse, but it needs to be, worked out just the same in terms of myofascial rolling, just like anything else. Okay. So with self-myofascial release, all right, what are we trying to do in terms of local effects versus global effects? Local, we're trying to reduce tissue viscosity, meaning the thickness of fluid within that region. All right, trying to make it so that it's minimized so that it can help the fibers contract and shorten and lengthen like they need to. It helps with fascial hydration, right? Maintaining proper fluid balance in there. It's going to reduce arterial stiffness, meaning that blood vessels will work better. All right, and at that point there, you have circulatory improvements, meaning oxygen is going to flow where it's supposed to, which helps with recovery. Okay, and then with global neurophysiological effects, you're going to have different input from your Golgi tendon organs, from gamma loop modulation and mechanoreceptor signaling. So basically, the nervous system is going to act accordingly, so that you will then allow afferent or sensory signals can be sent or felt as well. All right, and then also on the bottom here, so we're down here on the bottom on the pain modulation. All right, cutaneous receptors, on the skin, mechanoreceptors within the joints and the muscles, and then pain receptors can all be felt better as well. And then, like it says here, there's a reduction in evoked pain sensations and spinal level CNS excitability. So then you will end up with spasming that'll occur, because your nervous system is functioning accordingly. All right, so that's kind of the reasons why we're looking at this, but obviously we're looking at it from a positive muscle standpoint, because if the nervous system, the neuromuscular system works hand in hand. Okay. So we'll take the application guidelines and we'll break them down, in the next few slides here. But really, what are we looking at? We're looking at roller pressure, roller density, roller diameter, and roller texture. All right, all these things I know that a lot of you that foam roll in general know about, or again, use of other materials. But you know about all of these things. It's just how we break them down a little bit more. All right. So with roller pressure, okay, pressure it's basically the product of diameter and density. So if you have a foam roller that is very dense, okay, so like for most cases, if you're looking at just a foam roller, if you grab the black foam roller, smooth black foam roller, okay, and it has a small contact size, it's going to produce more pressure than one that is less dense and more round. Okay, although with more, we'll talk about each one of these separately, but that's what we're saying here. A rigid roller with a smaller contact size is going to produce more pressure. Now, more pressure is not always better. It's about toleration, and it's about what that person needs at that moment. Okay, so don't always think that more pressure is better. With density, all right, we said that density is the amount of pressure applied over that tissue, or density plays a role in that. Okay, but what happens is that if you're looking at it from the standpoint of three simple colors, white, blue, and black, obviously there's more than that, but those were the original generic colors of foam rollers. The white was the softest, blue was medium density, and black was very dense. Okay, obviously that's changed over time, and you have to feel out your densities now, but again, start a little bit less dense than what you probably think you do, and then achieve more density as you go. But again, this right here is the key. That whole aspect right there. No pain in this, okay? No pain. If density goes up too much and pain starts to occur, density must go back down so the toleration of pain is not felt, because that doesn't translate to a positive environment for you to be able to make that change. Diameter. So again, a smaller diameter creates more pressure, okay, and allows for you to get deeper layers of muscle tissue so that you can, create a better effect. All right. So again, a larger diameter has more surface area, and what that can do is it can equalize the pressure across the muscles. All right, so if we look at it from that perspective, larger diameter is going to have that happen. That may not be the best thing for an athlete or someone who's been a general exerciser who has been doing this for a long time. They might need something a little bit smaller to get deeper because they maybe worked out a little bit harder than a general population person. I don't know, but that's just an example to think about. All right, and then lastly, with everything here, texture. Now I know you've seen texture before in terms of different roller constructions. Um, you've seen the smooth texture, so smooth. You've seen different grid patterns. You've seen different levels of surface. Different heights. All right, you've seen knobs, you've seen grooves, you've seen all of these things. All right, you've seen where it might look like a peanut. All right, for example, and it's wider on the ends, narrower in the middle. All right, those are different ways. Well, just understand that those with textured patterns actually have been producing more force. Interestingly enough, though, the mechanism behind it, the research behind it, really isn't well known. Okay, so but understand that with research, though, they have found that texture has provided better trigger point reduction, and it's being able to break up those adhesions a little bit more. But the mechanism behind it is still not really truly known, but it has shown to work. Okay, so what are we looking at? All right, when we look at everything here, self-myofascial rollers, these are the ones that we know about. All right, we know that these are the ones that we've seen before and we've worked with before on many occasions, especially if you're an avid exerciser. So let's blow this up a little bit. All right. So these are the ones that are very common. You can buy them anywhere from Walmart to your sporting goods store to Amazon. All right. Myofascial balls, on the other hand, that could be anything from specific to myofascial release. It could be a tennis ball, a racquetball, a golf ball, if you really want to be a softball, a lacrosse ball. All of those are there. Handheld rollers, otherwise known as sticks. All right, you can grip them and pull them yourself, so you can actually create the pressure on your own. You can use vibration. Let's see. I think the company Trigger Point that makes the rollers over here. Trigger Point, who makes them, they create, and I think this Hyper Ice is another company that works really well. They have the vibration on the actual roller. Well, vibration can actually help with trigger points. It can help with breaking up adhesions and trying to get a little bit more depth into that muscle. All right. Cupping, on the other hand, it is it's a myofascial technique. And what you're doing is through heat, you're trying to release the tension of the fascia, that's being caused, and the tightness that can occur. And depending upon the area, you can see here that it's for the spinal area. Myofascial flossing, rock tape. Rock tape is a big company with this. Rogue Fitness, that makes all of the bumper plates and barbells and everything like that. They have a really good product for flossing. And what you're doing is you're taking big elastic bands and wrapping them around regions and actually going through. If you look here down at this girl right here, you can see that she's going through range of motion and trying to use that compression of the flossing tool to be able to release the tension in that area. And then lastly, over here with this here, like we were talking about before, Graston is the name, okay, and that's the technique that a lot of you're gonna find this with PTs, chiros. Those are all going to be those people that are going to be using this. But those are those blades. They, depending upon, some of them have hooks on them. Some of them have little ends. They might have they might just be a little bit here. Might not even look anything like that. But they usually have little areas where you're going to be able to wrap them around certain regions to be able to provide pressure downward, and then be able to to help release the tension to avoid like the spasming and everything we've talked about before. Now, there are a bunch of precautions that you'll see here. I'm not going to go through them, step by step, but understand here that, things like, scoliosis are an issue. You know, inability to put your body in the right place. Varicose veins. For those of you who work on your feet a lot, those office workers, actually, those office workers do because of their lacking movement. But you might find varicose veins a lot, and surprisingly, the nursing community and those who work in the medical field, where pressing on that area is very sensitive. It can hurt. All right. Fibromyalgia can be inflamed, just to name a few. Pregnancy, obviously, because of a lot of inability to move. And then some other contraindications here. You have any connective tissue disorders, if you have deep vein thrombosis, recent injuries. So there's a lot of them that are here, but just pay attention to all these. Don't have to memorize them, but just understand that there is a lot that goes into that. Okay. So what do we want to do in terms of the two-step approach? We want to reduce overall tension, and we want to introduce tissue movement. Okay, so the main goal here, like it says here, roll the targeted or compressed, compress, because if you go back and look, it's definitely, compressive force, pressure forces that we're using here. So just don't think of it as one-dimensional when we're reading this. But roll those targeted areas, defining those uncomfortable areas of interest. And from there, you also want to hold that pressure as well, because you don't want to just keep rolling over and over and over. You want to be able to hold on that trigger point and feel it so that you can then adjust accordingly. Okay. So then at that point, once you've found and reduced that tension spot, we want to then introduce movement. So then what we can do is go through active movement while we're rolling. So one of the things that I actually like to do is, if we were to be kind of like this, if we looked at the self myofascial roller, actually, they're both using lower limb here, but if we were to take this roller and be up by our shoulders, okay, I like to be able to put it on from the tip of the neck, at the very bottom, not even on the neck, but right below where the neck starts, and all the way down to my mid back. I like to be able to take and roll from that region. And then what I also like to do is be able to take my hands and go through shoulder flexion while I'm doing that. Start with my hands neutral on my sides, and eventually go as I roll down, as the roller goes from mid back up toward my neck. I like to be able to take and start putting my shoulders through shoulder flexion, because you can get more compression there. And by going through active movements, you can actually create the contraction of those muscles. Therefore, when the pressure hits it, those tension points are going to stick out more versus if you did it just statically. All right. So then what do we want to pay attention to? We want to, length of time, how often we do it, and making sure we're in proper body alignment. Those are the key practical components that we want to pay attention to. If anybody's ever been to a CrossFit gym, you know that you walk in there and a lot of times you might see, people foam rolling for, 45 minutes. And it's like, you don't really need to do it that long. I get what you're trying to do and be warm and ready to go. But just understand that, this is one of those things where, more time does not always mean better. Okay. Because if you look at the variables here, most days of the week, yeah, I mean, if you can get a little bit of rolling, it doesn't matter if you break it up, upper body, lower body, mid body, whatever it may be. But if you can get most days of the week, 5 to 7 days, I mean, unless you're told by like a PT or something, 5 to 7 days is really good. Doing one set of these movements per region. But what you want to do, like it says here, it's 4 to 6 reps. All right. So 5 to 7 days. All right. One set each. 4 to 6 reps per set. Okay. And then from there, the intensity is, it's individual, but it's based on, what your ability. All right. Ability level is optimal at that point. And then what do we want to do? Like it says here, 90 to 120 seconds per muscle group. All right, so that's here. The intensity is there. Our repetitions right down here, sets and frequency. All right, but that's what we're looking at doing here. All right, we want these acute variables to show. All right, we want them to be able to work. And again, what do we not want to have? Very simply put, okay, no pain. Cannot be pain. That's where we want to pay attention to that. But these variables are going to be the ones that, again, tried and true, proven, definitely something that works, all right? But this is the one thing, this is what I was talking about, not really making fun of CrossFitters, but just understanding here that, we definitely want to pay attention to the aspects here for, um, our total time. Okay, that's going to be really important for us to understand because, if we don't have, 5 to 10 minutes there is going to be optimal. So that's what we want to pay attention to at that point, 5 to 10 minutes. All right, anything more than that, you're not getting a more desired effect, anything like that. Okay. Here's some examples. This is what I was referring to when I was talking about, see how the lady has her arms back here? My arms would be straight out, but then they would start on the side here and they would rotate upward in that manner. Okay. So that's what I do with active motion, but hamstrings, quads, lats, be careful of this one. Definitely can really hurt depending upon tightness for these two. It just depends on your tolerance. TFL, this is the one that gets very tricky. All right, the TFL, one of the things that I have been reading with my own research with this is the TFL does not equal, all right, it does not equal your, your whole leg. Okay, you do not want to have that whole leg be compromised at that point. Okay, and by going down the whole side of the leg, what you're doing is you're basically you're going over tendinous tissue that does not need to be going onto. So what you want to think about is just doing up closer to the hip more so than you want to be going down the side of the leg to the knee. Okay, because tendon on the tendon is not going to have adhesions on it, and by rolling over it, it's not like a muscle where it's going to be able to just, it doesn't constantly go through shortening and lengthening. So that's why you want to keep it just to the muscle region. Piriformis down, over the top of your butt region. Adductors, although, it may look a little funny, this is so appropriate. Calves are very good, 1 or 2 legs at a time, depending upon you. Okay, and then your peroneals right on the sides, lateral portion of your calves, and then the lateral thigh itself too. Okay, but again, see, that's this one here is one you can kind of. This one's the one that I was talking about. Maybe you might want to, but it's not necessary at that point. So yeah, I mean, really what we want to do here is just for you to understand that this is the first phase of our continuing effort. All right, we know that it's a preferred technique. It's been used across the land, tried and true, but also make sure of this right here. Definitely screen before you do because you want to avoid these things right here. Contraindications at the finest, okay? We will always want to make sure that contraindications are taken care of. All right, so again, going back to the top, just really quickly, understanding again phase 1, and then after this, the next lecture we'll be talking about the next part, which is the lengthening, or that's more about the stretching component, which if you want to break it down a little bit more. All right, so that's chapter 3. It's a great chapter. It goes over a lot of really interesting things. It makes you really appreciate that SMR technique. All right, just remembering, and then this is definitely something that does come up within the test for this as well. All right, and it is talked about in the CPT exam as well, but it's definitely something that's more front-facing here because it's one of the first primary tools that's used when we work with our clients. All right, I hope everybody has a great day. I hope that everybody's staying safe, and we'll talk with you soon.